takes a village. Okay. All right. So here we go for the live birth. Here we go.
Who else needs roofing help this winter? Enrollment is still open for our roofing relief program.
Samia is the owner of a day spa in Philadelphia. She is 38 weeks pregnant with her second child.
With the first pregnancy, I delivered in a hospital, and it was very restricting. You know, being confined to the bed, not being able to, you know, move when I felt my body wanted me to do certain things.
For her son Safi's birth, she was given Pitocin to speed up labor, an epidural for pain management, and an episiotomy, a surgical cut to widen the vaginal opening. This time she's planning a natural delivery without pain medication and other medical interventions at a birth center.
Yes, I've been told that I am completely crazy for being, you know, for not having the drugs, but I've been there and I didn't like it, so I figured I would try this. It's healthier for the baby, it's healthier for me, so why not? I mean, women, we were designed to do this.
7 days after her due date, Samia's labor kicks into gear. At the birth center in Bryn Mawr, Pennsylvania, Julia Rush, a licensed nurse midwife, performs an internal exam and starts an IV line to give Samia a dose of antibiotics since she's positive for Group B strep. Samia is 3 centimeters dilated, 100% effaced, and her water hasn't broken yet, which is common in the first stage of labor. Birth centers offer a more relaxed and intimate alternative to hospitals for women expecting uncomplicated births. It's important to choose a birth center with nearby hospital privileges in case of an emergency. Helping her through her first natural birth is her husband, Arvin. Her mother-in-law, Irina, and 6-year-old son, Safi, are there for support.
We've talked about, you know, what he's going to see. We've shown him pictures, and I think he'll be okay.
As Samia's labor progresses, her baby's heart rate is monitored every 15 minutes.
My goal is to remain calm and try to stay level-headed.
As her contractions pick up, she starts experiencing painful back labor, typically caused by the baby's head pressing against the lower spine. Samia finds some relief by trying a combination of slow, steady breathing, constant deep massaging, and counter pressure, spending lots of time in a heated jacuzzi, and trying different labor positions.
Oh, she's doing great. She's doing great. She's really pushing through.
Her midwife feels it's time to break her water with an amni hook, since she can feel the amniotic sac bulging. This is a common procedure and usually helps speed up the labor process.
I thought it would be painful, but it wasn't at all. Actually, it was like a relief of pressure.
Large amount of clear fluid. Beautiful.
Her contractions now intensify as she starts to feel the urge to push. This is called hard labor or transition. The muscles your body uses to contract are transitioning from dilating the cervix to pushing the baby down and out.
The intensity of the contractions is increasing, and just a certain force is now really behind that baby coming.
Transition can be the most painful part of labor, but usually the shortest phase. Though most mothers dilate nearly 8 to 10 centimeters before transitioning, Samia is only 5 centimeters dilated and is having trouble resisting the urge to push.
Sam, do not fight it. Fight it.
I'm trying.
Her midwife agrees her body is ready to deliver. Pushing before being fully dilated is uncommon. This is why each caregiver has to manage her patient's labor on an individual basis.
Take a breath and do it again.
Her midwife uses her fingers to pull back her cervical opening as Samia pushes. The midwife made the right decision, listening to her body. With just 11 minutes of pushing, Arvin and Samia's baby emerges.
Good job. Good job. Come on.
Sami Siraj, a healthy boy, is placed immediately on his mother's chest.
You did it! You did it!
Dad cuts the umbilical cord, and the midwife collects some of the cord blood for routine testing. It's not over yet. The midwife helps deliver the placenta, and a nurse presses on the fundus, the upper part of the uterus, to check how much the uterus has contracted. Applying pressure is a common practice used by caregivers to help expel excess blood. Samia tore along her previous episiotomy line, and her midwife repairs it with stitches, which take 15 minutes to complete.
You did a hell of a job.
Samia is now breastfeeding and bonding with her baby. Incredibly, in an hour, she is showered up and savoring some well-deserved fettuccine alfredo. It was a fast delivery with just 4 hours and 11 minutes of labor. Samia's natural birth is a success, and she's ready to try it again.
One more. We're gonna try it for a girl.
Everyone played a supportive part on the birth team. Even Big Brother Safi got to announce the news that his brother was born.
Okay, you all survived, right?
I looked away.
That's okay. You gotta just go with your comfort level. All right, so we'll see, we'll talk about the next thing here. So then there's the cesarean section that was named after a doctor, Dr. Cesarean, that came up with the procedure. Basically, it's a surgical procedure in which one or more incisions are made through a mother's abdomen and uterus. The practice nowadays is to do a horizontal incision, and that will allow the mother in her next pregnancies to possibly have a vaginal birth if that was a choice that she wanted to make. If you had a cesarean section that was vertical, then they do not encourage having a vaginal birth after that. It has to do with the possibility that that incision could open up during the delivery and flood the uterus with blood, killing mother and baby. And so the horizontal one, there's excuse me, there's less risk of that happening. So, you know, nowadays it's the horizontal unless there's some reason they have to do the vertical. But I'm going to show you a cesarean section. It is a little graphic in the way that it's going into the human body, making an incision, cutting through tissue. So if the surgical side of it doesn't thrill you at all, again, you can look away, you can clamshell your computer, just listening. And so here is the cesarean video. And I will have to, again, go out and come back in because of the presentation piece. It probably kicked me out anyway, so you're probably wondering what I'm showing you, which is nothing according to you. Okay, so here's the C-section. Again, it's kind of graphic in its nature with the human body as far as, you know, going into the human body may not be pleasant to some people, so.
Oh, good morning, Mom. Good morning, Lisa. You're thinking positive, kiddo. You're having Boston today. Yeah. What a great name. Right? Isn't it a great name?
So I'm Dr. Hatch. I'm going to be your anesthesiologist today.
Okay.
Sounds like they weren't able to get an IV in you, so I'm going to take a look and see if I can help you out there.
Let's only do this once, okay?
Okay, my dear. On the count of 3, pinch. Ready? Get you numb. Ready? 1, 2, and 3. Big pinch.
Deep breaths.
Breathe, breathe, breathe. Burn, burn, burn. So sorry.
Ouch.
How's your hand? Is it going now?
Yes.
Deep cleansing breaths. That's what you do. Hang tight. I'm just. It's all right. It's in. It's already in. It's in. Good.
I'll dress it.
Okay. I'll just hold this like this for you while you do it. It's always good to have thing. So there's no more needle in there, okay? Take deep cleansing breaths. This is just a nice big dressing that's going to go on to make sure this wonderful IV doesn't go anywhere, okay?
All right. Okay, here we go. It's a little cold in here, Melisha, but that little step stool is your spot.
No surprises, that's the deal, okay?
Here we are.
You're gonna do great. Do you know what you're having this time? Right on. Okay, lots of cold soap on your back, okay? I'm not gonna sneak up on you, okay, I promise. Okay, another drape on your back. A little bit cold, a little bit sticky. Honestly, your job right now is to just focus on, before you know what you're gonna be seeing this person. And at that point, nothing else is really gonna matter what's going on. Does that feel like I'm pushing right over the bones of your back, or like I'm pushing right over your spine? Perfect. I'm gonna put some local anesthesia in there. It's gonna sting a bit. Remember, like for the IV? You're gonna feel that on the count of 3, okay? Take a nice deep breath for me. 1, 2, and 3. Big pinch.
Good job.
You're doing great.
Wow, awesome, Melisha.
Nice, easy, deep breaths, okay? Okay, you're doing a great job.
Slouchy, slouchy.
It's very hard to get your spine to bend when you have a baby in front. So part of it is just trying to get the spaces for Dr. Hatch.
It's more challenging when you're shorter
Yep.
as well, because everything's a bit more compressed.
Good. Still feel pressure.
Yeah. I think we're just dealing with very tight spaces.
Yeah. Stay in that same position. You're doing great.
You're doing super great. Everything's fine, okay?
Okay,
Just
okay,
a little
okay.
fine, but I think we're in the right spot now.
Nice. Beautiful. Good
Okay,
job.
you're just gonna hold super still for me. You're gonna feel some pressure and some warmth in your back
Remember
now,
the
okay?
warmth?
Pressure and warmth. You're doing amazing.
Wonderful.
Any more pain?
No.
Perfect.
Done. Okay, I
You were
know.
super patient with that. So if someone can help you with the legs, and then we'll just kind of rotate you in.
Just got straight down on your elbow. We got you.
You got this. I know,
Yeah,
it's gonna be
remember?
funky, of course.
That was the point, remember?
We make you numb and then we try to make you move, right? Let's see.
We're gonna listen to Boston's heartbeat, and then we're gonna put the catheter in, and then we're ready to go. Okay, guys? You guys okay for us to scrub?
He'll be in
In a minute. You shouldn't be able to feel much, except for maybe the pressure on your
You
belly.
might feel a little pressure.
Have a blanket. Okay?
Just keep in mind, you're the center of our universe, okay? We're all here for you, all right? Yep, you want to pull here? Very good. Sorry, dear. It's a way to help them retract, okay?
All right, we're gonna go scrub, okay? We're gonna go scrub, and then we'll bring Ryan in, okay, everybody? Okay, we're putting our gloves on, we're gonna put the drape on, and then we'll bring Ryan.
Her vital signs are perfect. She just feels a little yucky right now, which is pretty standard.
Okay, you're gonna feel some pressure. We're gonna get Ryan in a second. That'd be nice. Good, you should. Got everything I know, right?
Yeah, I mean, there's nothing fun about that initial feeling.
Okay, let's just measure for fun.
What time for the time out then, Jordan?
54, 08:54.
Okay, so Ryan,
It's marked and we're ready to go. Dr. Hatch, we are good. Okay, ready? We got Ryan to come.
he's going to be here in 2 seconds, okay? They're just going to out the door to get him now.
We're starting.
Barb, what did your OR say time-wise? What did your computer say? For skin tissue.
Right there.
Thank you.
You look great.
Okay, thank you.
Getting through all the layers. You can see the beautiful layers. Watch out for the knife. Okay, let's get the Bovie back just for fun. You're doing great, Melisha. We've already started, okay, cutie? Okay. We've already started. We're just going through the fascial layers now. All the layers, your beautiful muscles. You'll be pleased to know we're separating them, not cutting them. Okay, we're in the fascial layers now. Everybody's good. We're going through all the layers, okay? Okay. Make sure all the layers are all good. Making sure the bladder's out of our way. I'm met some bums again. Thank you. Just going through all the layers. There's some scarring here, so we're just getting a little layers up. Okay. Chest was tight.
You're just gonna feel funky like that. Right now, your oxygen saturation is 100%, okay? That's all good.
I'm okay. Okay.
You're doing a great job.
I
Everything's
trust you.
fine.
I trust you.
Everything's going
No
great.
worries,
I'm
okay?
trusting you. Okay.
You guys like
You're gonna
Nevada?
feel some pulling.
Yeah.
Feel?
I feel pulling. Yes.
Yes, a
You
lot of
did, yeah.
pulling, a lot of tugging, a lot of pressure.
Okay.
And at some point, honestly, it's gonna feel like someone's sitting on your chest, okay? That's
Okay.
normal, because they're putting a lot of pressure at the top of your belly to help deliver, okay?
Okay.
Lexus retractor. Remember, it's two pieces of almost cellophane. It's like a retractor, so we don't have to pull and tug. So we bring it in, and then we let the uterus come to us when we fold it down. Okay. All right, we ready for uterine incision, everybody? I'm going to start here, Jackie.
Yes.
Uterine.
What's your time? 9:01.
Want to be very careful because everything's nice and thin here. And you'd like to stay away from any parts of the baby. Here we go. There's the amniotic sac, so I obviously didn't go underneath the sac, so that's good. Butt is here, so we may deliver this baby breech. The butt's here.
Oh, my chest.
Hold on, lots of pressure from us. Here comes the baby's butt. We're coming out butt first. Look at the baby's butt. Hi, cutie. Umbilical cord around the body. Here's an elbow. There's a nut. Baby's delivering itself. Hi, this is Boston. Let's see if we can show Melisha. Can I show Melisha her cute little boy? Melisha, look. Look at this cutie. Can you see it? Oh, wow. You got him? Congrats. I know. Hi, Boston. You tell us, buddy. You're nice and loud. You're nice and loud, buddy. Nice and loud. You got him? Placenta is out and doing great. Wiping the uterus clean just to make sure. I'll take some rings so we can see all the layers we're going, then we'll take a stitch.
You can come on over and meet him if you'd like. He's ready for that. Yeah. There you go.
We're closing the first layer. We'll have a second layer after this. Okay? What we're trying to do is clamshell the uterus to hide the first layer of stitching by pulling the uterine layer around it so that it hides it and it gives it a second strength layer. So that's called a 2-layer closure, which is our normal layer closure that we have for a C-section. Everybody's good, Melisha.
The baby's okay? Yeah, look at him now. Oh, he's touching.
Everything's fine. He's just chilling right now. It's all good. How you doing? Okay.
Yeah.
Yeah? Good.
Tubes and ovaries over here, looking good. On this side. That looks good on that side, Jackie. We're done. Okay, we're going to put the uterus back in. Okay. In it goes. And then we're going to take the retractor out. And I'm going to close this all in one big layer. Trying to stay away from all the vessels and make sure we're fine here. All right, we will close now the fascial layer. And then everything's fine up here, Dr. Hatch.
Yeah.
It went great. Uterus is closed.
Let's see how big he is.
You weren't expecting that one.
3680, 8 pounds, 2 ounces.
That's a
8
big...
pounds, 2 ounces.
Yeah, no kidding. 8 pounds? 8 pounds. I knew he was big. He was, cutie. Get some credit for that. All layers are closed, Melisha.
Way nicer than that one.
And you will not have any staples or anything to take off. It's all underneath the skin. I know, right?
Congratulations. Boston's born. And thanks, everybody. I know, right? Come on, we did it. Hello, you, Boston.
Thank you.
Oh, my goodness, look at the chubster.
Thank you. I'm very happy, Dad. I'm glad Mama's doing okay.
Thanks, everyone.
Thanks, Pauline.
Now we're in recovery. Basically, you'll be here. We'll be checking on your vitals for the next hour or so. And when everyone is ready to go, we'll move you directly to your postpartum room, where you'll be for the next 3 to 4 days.
Okay, I want to see, what, can you move your legs now?
No.
Move your toes?
I can.
Okay. So we're gonna put your head up a little bit. When I put your head up, if you feel nauseated or dizzy or anything, you tell me immediately.
Okay.
Okay? Any questions for me?
When can I start nursing?
Right.
We're gonna go on this side to start with, just because you'll be able to.
Okay.
You'll be able to have your hand when you need it. Can you see this? No, I'm gonna
That's not a belt.
put him back in, inside your gown.
Okay.
How's that feel?
Fine.
I'm gonna try to bring his lower lip down just a little bit more. There you go. That's the one. How's it feel?
Like he's sucking.
Perfect. Not biting.
No.
Good job, Mama.
Thank you. It was not easy. The staff was really helpful. So I'm so grateful for them. I started sobbing because I was so happy. And he's so healthy, and I think that was the biggest thing. Having a healthy baby at any age is a blessing, but especially when you're older. I'm just really grateful.
Okay. Real graphic, but that is what a C-section is all about. So gives you an opportunity to kind of look and see for yourself. All right, moving on. So a VBAC, and I can kind of speak to this because I've had two. It's basically the letters do stand for vaginal birth after cesarean section. So it's a woman that has undergone a cesarean section but is now choosing to have her next child vaginally. You know, there are some risk factors involved, but your doctor will talk to you about those, and then you alone will make the decision whether or not you're going to have a VBAC. My experience is that the C-section, there's some things I did not like about it, so that's why I chose to have a VBAC with my other two kids. The C-section, you know, you're laid up, you're on morphine because you just had a major incision. You can't really be 100% there for the baby because you're still dealing with all the things that you had to undergo. It delays some things that are going on with the baby. So one thing that I had an issue with was that I was not able to nurse right away, and I didn't really know what I was doing because it was my first kid. And the lactation specialist, which is someone that kind of comes in and kind of shows you and guides you, didn't come in till like maybe the 3rd or 4th day. And so that, you know, just kind of delayed things because I was recovering, I guess you could say. You know, you can't get up and walk around after the procedure. You can't really hold the baby walking around because you don't want that pressure on your abdomen after major surgery. With the VBAC, you know, all of the things I just told you, I didn't experience. So that's why I chose the VBAC. I did have an epidural with the VBACs, and as soon as I had the epidural, the birth was very simple and easy and painless. You know, so that's you know, my experience that I can share with you, that I preferred the VBAC. I don't have a really high threshold for pain, so the epidural worked wonders, and all of my other pregnancies were fine. So I had 2 VBACs. Are there any questions about a VBAC that you have? That you might have a question about? Let me see if there's anything in the chat. Okay. All right. So then let's watch the water birth. So this is a water birth. This is another option of delivery. I'm not, if you have a water birth at home or if you have a home birth, insurance companies are leery about covering that just in case something were to go wrong. So if you ever are thinking about having a home birth, and Miss Gray will kind of chime in a minute, hopefully, because she's had experience with a home birth, and she will speak to it with her experience and knowledge behind it. And I'll show you the water birth video first, and then we'll have Miss Gray kind of chime in a little bit here. So let me pull that one up. And I'm sure I got kicked out again. Did I forget that I get kicked out? And I have to go back. Okay. So this one is the water birth. This one is, you won't really see a whole lot of nudity in this one. So you might be okay to leave your Chromebook cracked if you want to watch it. So this is the water birth. Okay, here it is.
We women love our tub time, and Mary is no exception. As a labor and delivery nurse, she's seen the best and worst of birth. For her, warm water is the ultimate pain reliever during labor.
I want to use the water to help me cope naturally with the contractions or the surges, and to help me deliver the baby in a more calm environment.
Mary and Dean tried water birth for the first time with their daughter Aubrey's delivery. The experience was so positive, they're headed to the tub again for the birth of their fourth child.
I will have 2 by land and hopefully 2 by sea.
Baby's head is right here. Perfect position for labor. Good girl.
Which
is great.
A water birth is my favorite way to catch a baby.
Karen Shields, Mary's midwife, has delivered over 200 babies in the water.
Everything has to be going terrifically for the baby to be born in water, as you know. And the baby's heart rate has to be what we call reactive, which means that the baby's, when the baby moves, the heart rate goes up, and there's no areas where the baby's heart rate is going down, and that your blood pressure is normal and everything's good.
You should not attempt a water delivery if you have high-risk prenatal issues such as diabetes, high blood pressure, or preeclampsia, you plan to use any pain medication, or your labor will be induced. While laboring in a warm tub has become more acceptable as a way to cope with pain during labor, actual underwater birth is still unconventional and considered risky. It's not recommended by the American College of Obstetricians and Gynecologists. If you're considering a water birth, talk to your caregiver about the risks and benefits. It's important to decide in advance what tub you'll be delivering in. You can use your bathtub if it's big enough, but most women either buy or rent a special birthing tub. Ask your midwife what she recommends. Mary will be using a tub at the New Jersey hospital system Elmer that's specifically designed for water birth. This tub keeps the water warm and has 3 access points for getting in and out in case of an emergency. After a long wait, Mary's labor kicks in 10 days after her due date. It's 9:30 p.m. and her water hasn't yet broken.
You're about 80% thinned
Yes,
out.
we got our 80 girls.
Mary is using hypnobirthing techniques, dim lights, and soothing music to stay relaxed and get through her labor. After 4.5 hours, Mary has progressed to 7 centimeters. The birthing tub is prepped. The midwife breaks her water with an amni hook. This is done before entering the tub to make sure the amniotic fluid is clear and free of meconium. The safe and comfortable water temperature for mother and baby is between 98 and 101 degrees. While Mary's in the tub, she moves into the transition stage of labor. This is the most intense part of labor. but the water seems to be helping.
It helps her mobility. It helps prevent tearing. It helps the mother's blood pressure be lower and just really gives her an overall feeling of comfort and relaxation.
The baby's heart rate is monitored underwater. It's hard to believe Mary is just minutes away from giving birth. The mood is calm and peaceful, and Mary gently rocks her hips as she focuses on her baby descending into the birth canal. Mary gets in position to deliver. Two nurses hold her legs back as the baby's head begins to crown.
Okay, I want a big push this time.
Okay.
With the next push, the baby's head is visible. The midwife quickly lifts the umbilical cord, which has wrapped around the baby's neck during delivery, and makes her appear bluish. While she's underwater, the baby is receiving all her oxygen through the umbilical cord. The midwife holds the baby's head for the final push. Mary and Dean's baby daughter, Ashland, is born. In seconds, she's brought to the surface.
Hi, beautiful. Let's float her a little. Let's float her. Hi, beautiful.
I think the reason I like water births so much is the baby's reaction. They come out so calm and relaxed. Their whole body just unwinds, and you can just see the stress just leave them.
Parents often wonder why a baby born underwater doesn't swallow the water, or even worse, drown. Karen Shields believes babies have an innate ability to avoid this.
There's what's called a natural dive reflex in babies, and that is so that they don't take a breath underwater. The stimulus for a baby to breathe is atmosphere or air on the cheek. That is what makes the baby take that initial breath.
The umbilical cord reacts to the air as well.
Until the cord comes up and is actually hit by the air, that's when the cord constricts and the blood flow is stopped to the baby.
In 2 minutes, Ashland, covered in vernix, is breathing on her own, and Dad cuts her cord. Mary gave birth to a healthy 8-pound, 15-ounce baby. The water birth was everything she hoped it would be.
Okay, and that is a water birth. All right, so let's go back to the PowerPoint. We'll do a few more slides, and then we will move into doing that article on the different births, or home birth. All right, so Mrs. Gray, do you want to talk a little bit about your home birth?
Sure.
Okay.
So I've had 4 children. 3 of them were in the hospital. My last one, my youngest, was my home birth, and he was 10 days overdue. So I wasn't sure if I was going to be able to still go ahead with my plan of a home birth. I didn't know if I would have to go to the hospital to be assisted in getting my labor started, but thankfully, didn't have to do that. We chose to do a home birth with our last one, partly because we had talked about it with our second child, and then just didn't, like, my pregnancy just moved along so quickly, we just didn't make the plans and get organized. But my third pregnancy, I actually delivered her 25 minutes after we got to the hospital. We were not in a room, no nurses, no doctors, no nothing were there. She just decided it was time and she was coming. So the joke in my family was that, with the fourth one, that I probably should camp out at the hospital for a week before my due date because I probably wasn't going to make it. So thankfully, though, everything went as planned. But for us, the home birth went, like I said, well, other than he was 10 days late. Everything went really well. I was in labor for about 2 weeks before I had him, just contractions on and off, but they weren't really productive. But with him, I kind of labored through the night, nothing horrible. I mean, I was still able to talk and eat and all that. But my water broke, and about 8 minutes later, he was born. But it was really nice for afterwards because I was at home. I was in my own bed. I was in my own home. My other children were right there. We had, other family that was there right afterwards. We had a couple close friends that attended the home birth. But it was nice because my midwife stayed right there with me for like 4 hours afterwards. Once, everything, the baby was good and I was good, she stayed and made sure I showered safely, and she prepared me a nice breakfast and just kind of really catered to me and what I needed at the time. And there wasn't all the interference, I guess, that you get in the hospital. I mean, they have to do certain things to make sure mom and baby are safe and stable and all that. I understand that, but it was just nice having that home experience. And again, just being there. There was no rushing to the hospital or anything like that. um, and like I said, I had 3 other children that I had at the hospital. My first, he was about a 6.5 hour labor, which from what I've understood then and now, that's pretty quick for a first pregnancy. He was 7 pounds, 6 ounces. My second was about 3 hours and she was 9'11". My third was the 25-minute delivery at the hospital. She was 8'5", and then my last one was 9'1". And as far as like any pain medications and stuff, that was another reason we chose to do a home birth. I'm not a baby when it comes to needles. I'm not afraid of them or anything, but I wanted to be able to experience the whole experience of labor and delivery. And I really was more afraid of the medications, how they would affect me, how they would affect the baby. I knew I did not want to have an epidural because I didn't want the needle in my back. That scared me more, I think, than the pain. So thankfully, I was fortunate enough that I had a good support system that I was able to deliver all 4 of my children without any pain med. And I don't say that because, I'm Superwoman or anything like that. It's just what worked best for us. It wasn't easy. It was painful. But it's what worked for me and my family. So, and of course it was an accomplishment afterwards, knowing that I was able to do it without any pain med. But yeah, for us, our home birth it was amazing. If I was having more children, I would certainly opt to do that, because that's what worked for us. So yeah, I don't know. Does anybody have any questions? Okay, I guess not.
All right. How you feel my pain? All right. So hopefully I'm presenting to you. So you got those notes. I know that I wasn't presenting on some of these. So if you heard me, and you have some idea, but a vaginal birth is just through the birth canal. A C-section is a surgical procedure. A VBAC is just having a vaginal birth after a cesarean section for a previous pregnancy. And then a water birth, pretty much self-explanatory, is having the baby, in the water. There we go. Okay. So now I have a couple videos on the birthing room and the operating room, just to kind of show you the difference between the two. So I will show you those. I'll probably show you one, possibly. And then I'm going to work on that article. And I think this one's pretty short. Let me look. Okay, so this one's just labor and delivery. So you can see that. Them just talking about this birthing room. 5 minutes, it's
Whether
perfect.
you use your basement for a guest room, office, or storage room, you're going to want to keep that space dry. In this
Hi, I'm Shannon Cook, mum of one with another one on the way. Now, while the majority of women in the United States have their babies in a hospital, more and more are searching for alternatives, like this place. This is the birthing center at St. Luke's Roosevelt Hospital in New York City. And this lady here is Rita Wagner. She is a certified nurse midwife. Hello.
Hi, welcome to the birthing center.
Thank you. It's very serene and peaceful here.
Yes, yes it is. That's why women come here.
Well, who's a good candidate for a birth center and who's not?
All right, well, birth center patients are women that should be low risk, patients that are healthy, their pregnancy has been healthy, no complications, singleton, meaning one baby, women who basically any age, as long as they've been healthy their entire pregnancy without complications.
Let's talk about this room. This looks lovely. This does not look like the typical hospital delivery room.
Right, right. That's why it's the birthing center. So in the birth center, we have the larger beds that the women can get in any position on this bed, hands and knees. We also have wedges that we put here in order for them to support themselves, bean bags. Some women bring in their birth balls, and they can use that on the bed or as well against the wall. We also have these wonderful deep tubs that we fill and have jets in order to have hydrotherapy during the labor. Water is very soothing and calming and allows the body and the muscles to relax, helping the women to cope with the contractions and get them to have the lovely labor and natural birth that they want.
And I love some of the chairs and like the mirror and the lamp, and you've got nice curtains.
Well, basically,
like
the idea is to make the birth center feel like a home environment. We know that when a woman feels comfortable, her body's going to progress more naturally and normally in labor. When you go into a labor and delivery room, sometimes they see the monitors, they get a little afraid of what might happen to them. Here we want them to feel comfortable so that that fear doesn't frighten the contractions away and allows the labor to progress naturally.
So obviously the women who opt to have their babies here, they want an unmedicated birth. What kind of ways do you help them through the pain management of contractions?
Pain management, well, the word pain, first of all, we try not to use that word. Discomfort.
Okay.
Labor is uncomfortable, it is, but it comes with a wonderful prize at the end. So what we do is we do massage, like I mentioned, the hydrotherapy, the birthing balls, which is comfortable to sit on. Also, you can use as a counter pressure against your back and the wall. And we try to keep them hydrated, allow them to move, whether they want to be in the rocking chair, whether they want to walk down the hall. This is their space. They're free to move and get in any position that they want that helps them feel most comfortable during their labor.
If you're having a baby in the hospital, you're hooked up to all kinds of monitors and they're checking on the baby very regularly. How do you do that here?
Okay, so in labor and delivery, yes, they're on the monitors, and it's what we call continuous fetal monitoring, which means during the entire labor, we're monitoring baby's heart rate and mother's contractions and how they relate to each other. Here in the birthing center, we actually have intermittent monitoring, which means we use a Doppler. Now, this might be familiar to you because you're pregnant. It's the same equipment we use in the clinic to monitor the baby's heart rate at your visits with your midwife or with your doctor. And so we use this, and we're using that in active labor. We're listening to the baby every 20 minutes. And then during pushing, we'll do it every 15 minutes, usually a little bit more often just because as practitioners, we want to be reassured, but the guidelines say that we would do that every 15 minutes. Again, these are healthy, low-risk women.
Okay. And what's this over here?
So this is just our blood pressure monitor. So we also monitor patients' vital signs during labor, and that's important because we want to monitor in case there's any complications arising, which can occur. Something like preeclampsia would be why we're checking the blood pressure. And then very important after the delivery to check mother's blood pressure, because we do lose blood when we have a baby, and we just want to monitor and make sure that we haven't lost an excessive amount. Bedside, we also have other equipment. We have here oxygen for the mother during labor. Sometimes women need a little extra oxygen, or if we think baby does, then we'll go ahead and put that on. We also have this equipment because although when the baby's born, typically we put it on to mother's chest, skin to skin, allow the mom to have that bonding moment, let the cord stop pulsing, let the family enjoy their new baby. But there are times when the baby might need a little bit of help, and so we bring the baby over here. We have suction to suction out any secretions, and then we have oxygen to help resuscitate the baby if we need to use this. We also can call our personnel down. We have a wonderful NICU team that come and help us here, or if we needed to transport the baby upstairs, we would.
Thank you so much, Rita, for showing us around this beautiful room.
Thank you for joining us.
Keep in mind, guys, if you want to find out more about birth centers and think more about whether or not they're right for you, search here on babycenter.com.
Okay. So let's go into Google Classroom here. Think about what I'm doing here. So, are you talking to Mrs. Gray, Monica?
Sorry, did somebody ask me a question that I missed? Oh yeah, I see it.
Okay, yeah, she was
How
talking.
bad was your pain?
Yeah.
Um, it was intense. I'll definitely say that it was intense, but you know what works for one person might not necessarily work for somebody else as far as how they're able to control their pain with the different positions, or like in the water birth or in the tub versus the birthing ball, or there's so many different things, but yeah, the pain level for me, I would say, was probably worse with my second, um, because she was almost 10 pounds. She was 9 pounds, 11 ounces. And when I got to the hospital, I was dilated to about a 5. But I think maybe, I don't know. I don't know why I wasn't in that much pain with her at that point, when with my oldest, it was horrible. Of course, I didn't know what to expect either. So, but thankfully her delivery went quickly. But I mean, it literally went from, they got me hooked up to my IV. The nurse was in there checking on me. My husband went down to get breakfast, and literally he left the room. The baby dropped, and I felt that, which was really weird. And I was in hard active labor right now. And he literally was only gone for about 20 minutes. And when he came back, I mean, I pretty much just started pushing. And like I said, 3 hours she was here. Not without some complications. Because she was so big, her shoulders were so big that's where she got stuck. And so they had to do a double episiotomy with her. And she was stuck in the birth canal for a bit. And so when she was born, she came out not breathing real well on her own, but thankfully everything worked out, and she did well. But yeah, the pain it's intense. It really is. And I mean, it, like I said, it just depends on each person, how you handle it and all the different stages of labor. But yeah, there's definitely pain involved with having a child and bringing a human into the world. It's definitely not easy.
Okay, thank you, Mrs.
You're welcome.
Gray. So if you're looking at your screen, this Plan Home Birth Safe, it's an article that has a link. So all you have to do is click on the link right here. I don't want you copying and pasting anything. Just read it through and then go to the questions and then answer them in a complete sentence. Okay. And there's only 5 questions. So it probably will take you like 10 or 15 minutes to complete. I know we're kind of at the time where we need to kind of wrap things up, but I would like this by the end of the day. Like I said, it's 5 questions. It's super quick. Just don't copy and paste anything and put it in incomplete sentences. Okay, and then turn it in to me. So, are there any questions that I can clear up? Okay, so everybody's heard what their assignment is. The next time we meet, we'll finish up our notes, and there'll be something else we'll do. And then Wednesday, we'll kind of get ready. And then I think I had it scheduled that the test will be next Friday. So I will do a review sheet so that it kind of reviews everything that we've done. And then you'll have the test. I believe it was scheduled for Friday. So, but things can change though with that half day in there with that Wednesday. I'm not sure how that's going to affect us. So anyway, have a good one. And if you have questions, just email me. Otherwise, get your work done and I will see you Friday.
Have a good day, everyone.
Thank you.
See you, Miss Epica.
Bye, Trisha.
Bye.